All right, buenos dias. How's everyone feeling? All right. I've heard a reference to family reunion a few times, and I'm going to go and echo that. We have a lot of family reunions in our families over the summer, and between the photos outside and all of yesterday, but also especially last night, I took a moment to just sit back and reflect and just smile. The energy, the laughter, the connections, this is what it's all about. I encourage us all to keep up that momentum as we move into this next panel, because it is we're leaning into the tough part of this work. And we're doing that in a very purposeful way, because that's what we're about. So welcome to the critical discussions on crucial role of social determinants of environmental health in the 30 by 30 work. So let's just be clear that we're all on the same page here. The World Health Organization defines social determinants as those that contribute to our conditions of that we come into when we're born, as we grow up, as we play, as we learn, as we work, and eventually as we age. So some of those examples of social determinants are the zip codes that we all grow up in, and all that is encompassing of that. What about access to health care, and whether you're able to even go see a physician or not? What about access to food, any type of food, nonetheless nutritional food for your growth and development? What about education access and the quality of that education? And of course, economic investment or disinvestment. These are all really high-level important indicators of how anyone, nonetheless a growing child, for example, does. And that's before we even get to the air, the water, the food, and the many other conservation-related environmental triggers that children and people are exposed to. So we have a very distinguished panel here, very thoughtful, experienced, and a panel that's going to bring it. I want to thank Jade for helping us pull this panel together. I said, we're only going to do this if we're going to bring it. We're going to have this discussion, we need to have this discussion. So we handpicked all of these four, and we're leaning into what I think and what I believe is a non-negotiable intersection that we must make sure that we uphold and hold ourselves accountable to, which is that social determinants and environmental public health factors have to be very purposefully interwoven into this conservation movement and into this work here of the America the Beautiful for All. I'm also going to be clear that we are standing on the foundation of what grew yesterday, and be very clear that we are starting at a place of where world concept of traditional conservation has been, which has been one of co-stewardship, the realities of the legacy of imperialism, colonialism, broken lands, stolen labor, oppression of indigenous black and brown people, and all that legacy has left with us. That is not removed from why and how we see how people are doing when it comes to their health outcomes. That's very much related. The oppressive and racist practices and policies over years have had direct impacts on the health and well-being of all living beings, as well as that of the health of our environment. So we offer in this discussion that it's not just about policy development. Policy is important, and we know it takes a long time, but it's what about the culture and the social determinants that are leading up to how well any said policy, even in the best of intent, will actually do. So I'm now going to introduce our panel. What they're going to do, I'm going to introduce all of them first, and then they're all going to give about 2 minutes introduction, comments, and then we're going to go into some questions. But by all means, as you have questions, we're going to have some time for that as well. So let's go. Nathaniel Smith is the founder and chief equity officer of Partnership for Southern Equity, and you may remember he spoke on our health briefing during the fly-in in the spring in DC. Welcome, Nathaniel. Joel Pennell is the vice president of urban forests and urban forest policy at American Forest, and it's been a pleasure to get to know you and look forward to your contributions on the panel today. Dr. Adrienne Hollis is Vice President of Environmental Justice, Public Health, and Community Revitalization for the National Wildlife Federation. Welcome, Adrienne. And Dr. Daniel Smith is joining us as a board member of the Alliance of Nurses for Healthy Environments and assistant professor at University of Buffalo, where I grew up in that area. So welcome, Daniel. Nathaniel, we're going to start with you. We're just going to kind of go through,
Oh my goodness, okay. I guess I picked a short straw this morning. So again, it is such an honor to have an opportunity to be here and be a part of such a powerhouse panel. I also want to just thank all of you in the audience who have made such a deep commitment to not allowing the power structure, and in particular the culture of legacy of white oppression, to separate the land from the people. And it is important for you all to continue to fight this fight, and to know that you have allies and people that support you, whether it be in rural areas or urban areas. We are one. I also want to just introduce myself, and again, I'm Nathaniel Smith. I lead an organization called the Partnership for Southern Equity. We're based in Atlanta. We do a lot of work around advancing racial equity in many areas, but our commitment is really around ensuring that this question of structural racism and its effect on our people and planet is front and center when we are engaged in key conversations about the change that is required. And of course, we'll have an opportunity to have a deeper conversation. My, I guess, key contribution, and I'll have a chance, I'm sure, to talk a little bit about our work, is to also ensure, and I thank you, Insay, for really framing our discussion. One other key piece that I also want to add is that racism is the social determinant of health for Black folks and historically disinvested communities of color. This worldview that is predicated on this hierarchy of value based on the color of our skin has manifested itself in so many ways, even when it comes down to our relationship with our planet and who is valuable, who, you know, as it pertains to who lives on it. And so I will, of course, talk a little bit about the work of PSC soon, but again, thank you for giving me an opportunity to participate. Thank you.
Hi, everybody. I'm Adrienne Hollis, as Insay said, and first, I'm very happy to be here. It seems like I'm at the tail end of this. Everybody knows everybody else, so I know a few good people, and I'm an introvert, so that's a lot for me. So I do want to say that when Insay and I talked about my coming, I had a lot of personal issues that she knows going on. But when I saw the title, New Era, New Leaders, in addition to the traditional, you know, your first thought about young people being new leaders, I immediately thought about older people who've been doing this work are now being heard, and so that they are in new leadership positions, right? Sadly, some of those are voluntary, which I think, you know, we're still doing a little extraction there, but like with the White House, EJ Council, and other places, so that's an issue too. But I thought that the title resonated with me, and the work that we do at the National Wildlife Federation, my program in particular, which focuses on community resilience, not just in climate change, but environmental racism, systemic racism, you know, issues, yes, around climate, around COVID, around all the challenges that we face. So I think that, you know, this is a place to be. And my last statement, intro statement, is one of our good friends, Jackie Patterson, has this certification program. And the one that, one of the ones that I did with Dr. Mimi Parker, and I did get Insay to do a different one with me, was called Conservation Done Right. And I was immediately struck when I walked into the room that conservation done right looks like this, right? Looks like this room, so I'm happy to be here.
Good morning. So I'm Joel Pinnell with American Forest, as NC said, and it's not often that I get to talk about issues like imperialism and colonialism directly on panel. I work for a national nonprofit, and so I'm not going to tell you my true thoughts on capitalism while representing the people who sign my paycheck. But what I will say is that, you know, within a system of capitalism, there's certain privileges and there's certain rights that I think we all agree on. And so the size of your house might be a matter of privilege, but we all have the right to live in a neighborhood with clean air and clean water and protection from things like extreme heat. The vehicle you choose to drive is a matter of privilege, but we all should live in neighborhoods that are designed so we can safely navigate as pedestrians or cyclists or transit users. And so these are things that in a nice place like Puerto Rico, a heavily forested island, we sort of take trees for granted, but we know that tree coverage in almost every neighborhood in America, or most neighborhoods in America, heavily falls along the lines of race and income. And so American Forest, we have a tool called Tree Equity Score, and you can look census blocks by census block at how tree canopy aligns with socioeconomic demographics, health, CDC, Health Vulnerability Index, and you can really see how cities and communities are equitably providing tree cover for their residents. And so Puerto Rico is coming out next month, and so working on the data for that. And so that data shows us that across the United States, our highest income communities have 36% more tree cover and are 7 degrees cooler than surrounding neighborhoods. And our neighborhoods that have the greatest concentrations of people of color, regardless of income level, have 45% less tree canopy and are 10 degrees hotter. And so the health implications of that are huge. I think we all know it's getting more and more attention in the press. Extreme heat kills more people than tornadoes, floods, and hurricanes combined. And so this is an issue that we've got to address simply by doing, it's more things than just tree cover, but tree cover can impact a neighborhood by as much as 20 degrees. And so who's dying from that? It's not the wealthiest people who can get in their car and run their central air all day. It's the most vulnerable among us. And so New York City does a study where black people in New York City are twice as likely to die from extreme heat as white residents. And so we've had between 2019 and 2023, over 200,000 incidents of extreme heat. That's a 400% increase of just 30 years ago. And so I'm looking forward to talking about more of these issues, but when we talk about the relationship of who gets access to trees and green space in nature versus who doesn't, I look at something like Central Park in New York City, where they actually, Seneca Village was a neighborhood of predominantly black homeowners. They eradicated that neighborhood to provide a enclave for white rich residents. 100 years later, you fast forward, where the Texas State Fair is in Dallas, in 1966, they did a report. The City Hall of Dallas ordered a report. They said people were not coming to the fair because they did not want to look at poor Negroes in their shacks. And so they demolished that neighborhood and built a parking lot that's basically used 4 weeks out of the year. And so these are the sort of things that, we cannot accept. And so I'm looking forward to the conversation about how we move forward and how we rectify what we've created.
So, as Insay said, I'm Daniel Smith, and I'll address kind of what I think is the elephant in the room. I'm a nurse. It's kind of been fun being a nurse, a medical professional at a conservation conference like this and seeing all the viewpoints around what it means to focus on the environmental health determinants. I will approach today's conversation. I am a nurse practitioner. I provide primary care in a federally qualified health center to low-income and unhoused residents of Buffalo, New York. And I really see through my work in the clinic how the environmental and the social determinants of health play out in the day-to-day. It is some of the most frustrating work that I've done. I'll never forget in 2023, I was working at a FQHC in mushroom farm country in Pennsylvania, and I had undocumented Latinx farm workers come in and say, I can't breathe. Why am I having an asthma attack? I'm 22. And you look outside and it's like, well, it's the wildfire smoke that's coming to Pennsylvania from Canada. And it's really those direct connections that have brought me to this work. And on top of that, I do extreme heat research, so more so on the extreme heat side than the actual conservation side. But it's a very unique linkage, I think, that particularly those of us in nursing where we're struggling in a field that views race as a biological determinant of health and not a social determinant of health, and being on that other side to be like, no, it's racism. So for those of us in the room that have had struggles finding acceptance in the mainstream version of albeit nursing or conservation, I hope that we can get through that and just remember the work that we're doing is hard, but it's worthy.
Thank you all. Thank you all so much. Thank you all so much. And in the spirit of doing, and I know you all are doers, what advice, recommendations, these are big milestones. We didn't get into where we are overnight. We're not going to solve all this overnight. But again, the intentionality about making sure that public health professionals are not working over here, conservation over here, and everyone else in the middle. We are not going to get to the type of goals in the expeditious way that's necessary in that fashion. We definitely have to be blended in a much more intentional way. What recommendations do you have for this effort, this growing coalition that will not continue to grow with the type of diversity that Adrian's talking about if we don't stay true to these morals and these values of making sure that vulnerable community voices, social determinants of health are acknowledged and are part and baked in to our strategies here. So how do we start to dismantle in a purposeful way the traditional confines of the conservation movement and all the legacy that it brings with it? I know, we just jumped right in, just heavy.
I was going to jump right in.
Okay.
Working for the National Wildlife Federation. So we know that conservation wasn't created for us, right? It was created for sportsmen and people who want to hunt and fish, not because they need to, but because of sport. And first, by the way, I love the tree equity. I use it all the time. Y'all should use it. It's great. Anyway, Chairman Mallory said something today. She said, being in those spaces sometimes, even if you're the only one, you know, that's important. And I think we all have to have that courage. I've been at both the Union of Concerned Scientists and the National Wildlife Federation and a couple of other spaces, and the darkest thing in the room. But we have to speak for each other. You know, I grew up, my brother was asthmatic, as were family members and friends, and we didn't have wildfires in Mobile, Alabama. It was pollution, you know. And when I talk about those stories and others, that's what people need to hear, that this is real life and lived life. And so we have to have the courage to be in spaces where we're not traditionally welcome. And even in the face of, I guess, opposition from some in the room, and from some who you've worked with in other capacities in EJ. Like, I've been doing EJ for 30 years. And there's some who think, oh, now you're working for the man, you know. Well, you know, I'm not. I'm working to dismantle the man. You know, and we all need to be looking for opportunities to do that. And it's hard. You know, there are days when you can't do it. You know, you don't want to go in to work. You don't want to have one more argument. But you have to, because you're not doing it for yourself. And one last thing, I've been asking people about this. Yesterday we got the blessing, and the gentleman said, and I'm going to mess this up, so somebody correct me, may all of your obligations be met, or responsive, something like that. Whatever it was, it resonated, believe it or not, even though I can't remember it. And what was it? Yes, that's what Esther said. All of your commitments be met. And I tell my staff and my students, because I also teach, is that this is not a job. This is a calling, you know, and you've got to be passionate about it. And that means you've got to be passionate and outspoken in any space. So I didn't mean to be that long.
So I'll take this from kind of the outsider's approach in what I do. And whenever I'm speaking about privilege, I'm primarily speaking about white privilege in what I'm about to say. But I remind all of my students that I work with that when we're doing community-based work in these spaces, that we're facilitators, we're the visitor. And I think any time that we're approaching conservation, environmental health work, as a visitor with privilege, we have been invited to the table, and we sometimes have to put the needs of others before our own. we really run into this in the academic setting in terms of like publishing, for example, is kind of the albeit, right? And it's like, well, we just want to get this paper out there. And I remind those that I work with, well, what are we really here for? Are we here to publish, or are we here to make health better for the communities that have invited us in? And that's a really difficult conversation to have, particularly in academic spaces, but I think the sooner we get to a point where we can recognize the relationships between those of us doing this work, sitting in this room, having that inherent privilege, and the communities that are living and suffering from these social determinants of health and environmental determinants of health, the sooner we'll get to a place of creating health equity for all.
You know, I think it's also important for us to, in particular in this time of people wanting to erase history, erase the relationship between historically and what we know, the relationship between the extreme extraction of our natural resources and the extreme extraction of land and labor in ways that help build this country. It's important for us right now to really lean in. I think right now there are many larger organizations as well as foundations that are using the Supreme Court and the aggressive nature of our opponents as an excuse to step away from their responsibility of working to advance towards racial justice. And I think that it is important that we do not give up and continue to press forward in our belief that our relationship, the relationship between our most vulnerable and our planet, is the relationship that will allow us to be and become the world we need to be for everyone. That we can't allow people to just all of a sudden one day say, we want to support organizations that are led by people of color, black people and indigenous people, and then all of a sudden say, we changed our mind. We have to be willing to be courageous and say, no, we are going to continue to advance this agenda in ways that honor and elevate the challenges that we're facing around structural racism, and in particular, how it has affected not just the conservation movement, but all movements that are working to create a better world for all people. The second thing that I think we have to be willing to do is not allow ourselves to believe that we alone have the silver bullet as it relates to the liberation and freedom of our communities. You know, we have to embrace the lived experiences of the people that we say we serve. The people that we serve don't have a heat challenge on Monday and a housing challenge on Tuesday, or a transportation challenge on Wednesday, or a health problem on Friday. They have those problems every day, right? So I think we're coming from a place of privilege when we believe that if I can just solve this issue, that everything will be okay. And if we believe that, we're going to lose. We have to be willing to reach towards other issues, other communities that also feel like they have a part to play in creating a better world. And that means that we have to step outside of our comfort zone and engage, you know, certain issues in certain communities that you may not be comfortable engaging. But if we want to win, we have to do that. And we will win. But if we want to win, we have to be willing to reach out to the various communities that also care about the communities that we care about, but are looking at the challenge from a different lens. And so that's why I feel like this piece around the social determinants piece is such a great opportunity for us to build bridges, because it forces us to really look at the comprehensive nature of oppression and really work together, right, to figure out how can we begin to be more collaborative in how we're approaching the various challenges that the communities that we care about are facing.
I would add that the conservation movement still has to center and prioritize people. And so even with 30 by 30, it's easy to say, look at the most acreage that we can protect. And yes, we should do that, but also, how is that impacting people's lives? And so foresting a neighborhood in a city or in a densely populated urban area is going to have much greater impact on people's day-to-day lives than large landscape work that is all important, but we've got to find different ways to measure the impacts on human health and what climate change is doing to the most vulnerable amongst us. And I think, priorities are reflected in budgets. I'm the lobbyist on the panel. You can tell by the way I'm dressed, I guess. But, Chair Mallory mentioned the Inflation Reduction Act and the $1.5 billion that went to the Urban and Community Forestry Program. That program typically gets about $35 to $40 million a year for the entire country. And when I was on the Hill lobbying, this program needs more money, people within the Forest Service were saying that there's just no way. People at USDA said we just don't have the money. You spend $20 billion a year on farm subsidies to go to these mega farms, but you can't adequately fund a program that impacts 84% of the country. And so I think we can't accept the status quo. We can't accept people allowing things to continue as they have been just because that's the system and it's benefiting the richest amongst us and a very small percentage of the country. So we've got to continue, or not even continue, we've got to start prioritizing and centering people in the conservation movement.
So I heard we have to have courage. We have to lean in. We have to fight back on efforts to erase history. We have to put people at the center of this work and the various real needs that people have every single day. The storytelling aspect too, this is really critical, allowing the communities that you're serving to speak on their own behalf. Many times people don't understand the connections we're trying to impart here. Stories will start to tie that together. So I've got a question. How many of you either work with or have advisement by or know where to go to for technical assistance when it comes to social determinants or public health in the work that you're doing? Just honest check. Not enough hands. So one of the first assignments I think that's doable, start to align yourself with some public health oriented people. I guarantee you by having different people in your circles, your outcomes, the stories, your approaches, your concepts will be different. They'll be naturally integrated. It's never gonna be perfect. These are worlds that have been traditionally separated for a lot of reasons, including the funding mechanism, so we haven't had the chance to work together. But there's a true beauty in what we're doing here and how that can be multiplied on magnitudes of order in your community. So that's one thing. But then I'll take it back to the panel. What might be other ways that we can track our success? It's one thing to say we want to put people first. We need to do these things. And it's very different for a lot of these groups who haven't necessarily come together, these efforts to do this. What are other tangible examples we can impart on our friends here to help you understand some of the goals we might want to go for and how we can measure whether we're really holding ourselves accountable to these aspirations or not?
So I can go if no one else has anything. I think one of the biggest things we can do is start to track our connections. Thinking about your connections from a healthcare perspective is we have EMRs that create a lot of data, and we don't have anything that tracks the environmental determinants of health in our EMRs. We have some social determinants of health, but not really environmental, and I think those things are ripe for the picking in terms of connections with public health departments, with academics in this space, with practitioners, is really starting to think about how do we develop the tools necessary to do this. There's a lot of funding right now for the NIH for common data elements, which I think are historically underutilized, and the connections and the ability to make those connections, we've never been at a better time. I know public health departments are thinking about sustainability, they're thinking about ways in which we can talk about the the environmental determinants of health, because we've realized we've been talking about social determinants of health, but how do we apply them? And I think that application is through environmental determinants of health, and you all in this room have the applied knowledge and the expertise that healthcare and public health experts are looking for. So making yourselves available, really thinking about how can you buy out that time, and healthcare has a lot of money to buy out time. So be sure to ask for it whenever you want to partner with someone.
Go ahead, brother. Go ahead.
Yeah, I would just say we talk about showing up a lot here, and we've got to show up at home. Those of us with relative privilege, when plans are being made about how we're designing our neighborhoods, where highways are going to go, we've got to show up, and we have a lot of data. So thank you, Adrian, for saying use true equity score, and Daniel just mentioned a lot of the data that's already out there, and so we have a lot of data in our hands. We need to democratize that data so that people can use it freely. As long as you have access to the internet, you can get on things like True Equity Score. And so knowing that childhood asthma in cities like Newark, Detroit, Richmond, Virginia, my hometown, is 4 times the state average, because when we decide to build highways, we go through the poorest and blackest and brownest communities, and they're overexposed to pollution, and they don't have the natural air conditioning and air filtering of trees and green space. And so taking the data that we have, and again, those of us with relative privilege, showing up and saying, we're going to design our cities, we're going to develop and build out our neighborhoods in ways that ensure these basic rights of access to nature to everybody, regardless of income, regardless of what we look like. And I think we also have to get over the not in my backyard, the NIMBYism, because we see it all the time. I'm probably guilty of it too sometimes. We talk a good talk, and then it's like, they're going to put that affordable housing in next to my neighborhood. I talk to people in D.C. all the time. I live outside of D.C., and they're like, oh, this shared affordable housing just doesn't work. The people are, my neighbors are this, my neighbors are that. And these are the same people who show up at meetings talking about fairness and equity and all of these things. And so we've got to show up, and we've got to use our relative privilege to make a difference when we can.
So I'm going to take it from another perspective as a reformed researcher. And we still have my organization still has a research and analytics arm, and we do a great deal of research, but I also believe that we are in a time where decision makers are making decisions in spite of the research. All we had to do was look at the debate last night to understand that people are creating their own facts in order to justify their ignorance and racism. And so I think that it's also important for us, to begin to look at it from a power building perspective in terms of our ability to influence. Privilege is only powerful unless you're willing to share it. I'm going to say that again. Privilege is only powerful if you're willing to share it. What do I mean by that? How many leaders are you making or supporting or facilitating through your privilege? Are you designing leadership programs that are engaging your fellow brothers and sisters in ways that will position them to have their own voice and agency in order to fight for their own communities? Are you working to organize those leaders in a way that will position them to infiltrate the power structure that is playing a role in making the key decisions that are affecting their lives every day? This is the long game. This is not going to happen tomorrow, right? But we have to begin to think about our responsibility as it relates to facilitating and growing the agency of the people we say we serve, working to ensure that the next time we come together, that it's double the people in this room because of the agency cultivation work that we've done. And also be very specific about what I call the battle of the baseline, right? How are we actually influencing what is being measured through infiltrating where those decisions are made and working to ensure that when those policy decisions are crafted and designed, that they reflect our values, because in essence, policy is just a reflection of the values of people in power. That's all it is. So how are we translating our values within the context of public policy? And really the only way that you can do that is by growing power and influence. And we have to begin to do that and measure that as well.
So one of the things I do when in my spare time, which I have a lot of, I'm sure we all do, is I co-direct the Region 3 EPA Thriving Communities Technical Assistance Center grant. And we cover Pennsylvania, Delaware, DC, Virginia, West Virginia, and I feel like I'm leaving somewhere. Thank you, and I knew that, I lived there until April. But when I was so kind of surprised when very few people raised their hands, because Puerto Rico is one of the focal points for one of the TIC-TACs also. And these are places you can go to for technical assistance and support. And one of the things that we are focused on is to, help people write grants. Because we know that we are traditionally automatically excluded from funding considerations, just automatically. And some of that is based on the fact that our grants, our applications don't look like other people's, because we don't have professional grant writers, whatever. We barely have 2 people holding an office, open an office, paying the rent, the home, your home rent. And so, utilizing these centers, because there's money that's been set aside. We have 12 million. It sounds like a lot, but I promise you it's nothing. We have a train-the-trainer approach, a hub-and-hub approach that's community-led and community-driven. And we have 12 organizations, EJ organizations and universities, HBCUs, or I think we have one that focuses on tribal issues, I'm not sure, that are designed to address the needs of anyone who calls and asks, And the problem with that, and the problem with any funding, is making sure the people who are supposed to get the money are the ones getting the money. And that's what we've been seeing. That's a challenge that we've been seeing. And also the design of a project. I think I could talk to you forever, because you said something else that resonated. When we're, it's important for us to be in this, to be in these spaces and for our voices to be heard. Sometimes we do that, like we did with the federal, anybody in here from the federal government, from the EPA grant, and they did it wrong anyway, right? And we have to keep talking about it and keep insisting on things to be done. And you're right, there's so much data out there. People don't know how to access it. People don't have resources. And that's where you reach out to others. So that's a big part of, I think, actions that we need to engage is identifying where there's technical assistance and what that looks like.
Thank you. So we heard tracking your connections. So that means you first have to be working on those connections. Many of us are willing to help. We know lots of people who are very engaged and energized and would love to connect and find out about that bilateral learning, as Daniel mentioned. We also heard about privilege is only as powerful as those who are willing to share it. So another call. So we've got at least 2 calls to action, along with other things I hope you're hearing. Think about who you can connect with, how you can diversify that connection, how that byway learning can happen. It will happen almost instantaneously. And also, what about in your own organizations? How are you helping to cultivate a place of diverse perspectives so that people not only see themselves there, they see themselves growing there? That's another aspect of that. You talked a little bit about funding. I don't know that we'll be able to get into that any further, but also leaning on what we heard yesterday during the lunch hour, funding is not going into the communities that are the most harmed and have the most solutions. So I think we would also articulate we need to be very strong on making sure that the funding philanthropic community gets that pushback from us collectively, that we don't just toe the line and go with whatever aspect they've somehow miraculously decided is the pathway, but rather stick to the pathway that we know is going to get us the gains on the return. So when we talk about reparations, let's just go there, and restitution and repair, particularly in neighborhoods that have been the most impacted, how do those elements also show up in this new age conservation movement?
Well, I'll just say that to go back to where you started, I think it's first understanding that the delivery systems of the federal government as it relates to how funding is distributed in communities have actually been used to harm black communities and historically disinvested communities of color. That the history of procurement and contracting in the federal government and locally has been inherently racist and been used to harm communities. So whether it be dollars to build highways or dollars that were sucked out of urban communities through redlining, whether it be through FHA or many of the policies that you've had to deal with, those policies have been used in many ways as blunt objects that have either protected or expanded white spaces, whether it be in urban communities or rural communities around the country. And so we first have to acknowledge that. The second thing that we have to do is work hard to disrupt those delivery systems or replace them in ways that will facilitate the type of equitable funding that you are talking about. You know, putting good money into bad systems will continue to realize bad results. It doesn't matter how much money we put in a bad system, it's still going to generate bad outcomes or outcomes that could be harmful and accelerate inequity in communities. And so by looking at the work of strategies like the Justice 40 effort, is not just an effort that is advancing sustainability and a resilience agenda, but it's also providing opportunities for us to repair and heal harmed communities through federal dollars, provides a great opportunity to reimagine the way that funding is distributed and that things are done in communities. One example, and say, if I may, of course, is, you know, the work that we've done with the Justice 40 Accelerator. And we actually have a grantee here in Puerto Rico where we work with philanthropy to create not only an army of technical assistance advisors, but also we provided funding for organizations, as well as now we have a revolving loan fund, and we have navigators that are assisting frontline organizations in competing for federal dollars. And we've been doing this now for over 2 years. We've been able now to work with over 100 organizations around the country. We have a 80% success rate and have been able now to draw down close to $55 million from the federal government in ways that support frontline organizations to really realize the goal and the aspirations of the Justice 40 Executive Order. And so for us, it's about making sure that we acknowledge those barriers and that the role that the government has played in harming our communities. And if we're talking about repair and reparations, and say we have to first start there, right? That the systems that we're depending on to heal our communities are designed in ways that are harming our communities, and we have to do all we can to disrupt that. We have to stop the pain first before we can move forward and try to facilitate any type of real outcome. So that is one of the places that I would start. Mm-hmm.
So I'll be quick. So as I've been sitting here listening to all the challenges that we face, I tear off a little piece of paper, and this is what we are visual, because I'm a professor, of what we are left with, right? And there is no reparation that you're going to do that's going to put me back together, unless you recognize that everything is interconnected, right? And more than just people in the planet, but the issues, the social determinants of health, the public health issues, those are all the things that I know I focus on and a lot of us focus on together. And we have to think about that when we talk about what a person presents to us with, because we don't know their history. And that's why, as Insei said, storytelling is so important, because we need to know why we only have this to work with, and yet we want to produce a number one stellar person, if it's a child or an adult or someone who's, you know, a returning citizen, right, to our community. What are we working with and why? You know, what are the challenges, environmental and health and everything? So I think that knowing the history is important. So.
Yeah, and I know we are running short on time, but I could talk to you and the entire panel all day as well. On the last question, I wish I had gone after you because I think you're exactly right. They have the data, they don't care. In terms of reparations, you know, you could look in many ways at, through the Inflation Reduction Act and the historic investment in environmental justice as sort of a fraction of a down payment on those reparations, but in terms of how it was administered, so the Urban and Community Forestry Program, again, because I've worked closely with that, you know, that the legislative intent was that that money was going to allow the Forest Service to directly grant community-based organizations, smaller organizations, quote unquote, lower capacity, who are working directly in communities that had the greatest need for increased tree canopy. And what we saw is that of that $1.5 billion, they gave $250 million to the states off the top, and then the vast majority of it went to cities. And the problem is that cities, and I'm stealing this from another panel I was on from another panelist, they said you gave the money to the same decision makers who were responsible for a lot of the injustices that we're already seeing. So that, yes, there's different people, and there's great people at the local elected level, at all levels of government, but to Nathaniel's point, it doesn't matter, because a good actor can only do so much in a system that's designed to do what it does. And so we were talking about this last night in terms of, you know, I often talk about, the people who are most impacted by extreme heat and lack of tree canopy and air pollution are, you know, the most vulnerable amongst us, the poorest, the blackest, the brownest, those with disabilities, those with pre-existing health conditions. We know that. Guess what? It's designed to impact them the most, because climate change can only happen if we have places that are expendable. And we can only have expendable places if the people who live there are expendable in decision makers' eyes. And so with all that said, we never thought, at least I never thought, as long as I've been working on urban greening issues, that we would get something like the Inflation Reduction Act with that amount of money. And so we have challenges about the way that it was distributed, but let's not let that, there's a lot of people who are looking at that and saying it's a failure, and we told you we shouldn't give money to places. And so we've just got to build upon that, and we've got to address this capacity issue. And so that's really, you know, I'm thinking of Vu's comments yesterday, where these funders, even in the federal government, are saying, well, we know all the strings that come attached with a federal grant, and these lower capacity organizations can't handle it, blah, blah, blah. Well, we've got to do something about that then. Then give them capacity. Provide them resources, you know, like the Tic Tacs and others, that are allowing them to operate and solve the challenges that their missions are already aligned to do. They just don't have the resources. So we can't have the circular argument about, well, we can't give you money because you don't have the capacity to handle it. Then increase the capacity. And, you know, I don't have the exact answer on how we do that, but that's what we got to work towards, and we can't allow. It's not going to be perfect. It's not going to be perfect, and we've got to just continue to move towards better practices and better policy.
So I hate to not be as joyous as we are supposed to be at this conference, but I want to, and forgive me, this is a little out of left field, but from my clinical experience as a harm reduction nurse practitioner working with people who use drugs, we have to make sure we cross our T's and dot our I's in everything that we do. In Philly, I was working in Kensington, which Philadelphia, North Philly is very black and brown, and Kensington is where the open air drug markets are. And we were having barriers in place in terms of treating people and getting Medicaid to pay for services. And so as a clinic, we all started advocating for changes in these policies. And we saw that the policies were changed, but then immediately, as soon as we changed them and where we're using Medicaid in ways that we were now allowed to, our audits started going up. And we kind of think under the low, right, that was the state's way of saying, we're going to try to catch you doing something that you're not supposed to, so that all of this advocacy work that you've done to protect and treat Black and brown people with dignity in Kensington and take that money away from you. And luckily, we all were kind of prepared for it. We started changing our documentation, listening to things that were going on, and I think there's a large parallel between what we can do in the conservation movement in terms of just making sure, and again, it takes technical assistance, but we have to make sure that we're playing by the rules so that we don't give anyone a reason to take away the money from us. And it sucks to say, because we want to all subvert the system, right? But at the same time, if they find one little nook or cranny to take away money and say you did something wrong, they're going to do it. The people in power will. So just making sure that we're all working together to support one another and make sure that nothing can be seen as fault on our part in this movement.
And say, can I add one thing, just quickly, just for a second, if I may? You know, I also think that we need to acknowledge the pain and really the trauma facilitated in our communities by what I call the nonprofit industrial complex. You know, I think it's very important. So when we talk about reparations, I think we also need to acknowledge the fact that there are many well-resourced organizations that have received funding on the backs of Black folks and the pain of people of color, and they've used that as a commodity in order to raise money for their organizations. And a lot of times, a lot of those resources don't get into the communities that they put on the cover of their annual reports. And so, you know, I also think that for some of those larger organizations, if they are serious about being allies to frontline organizations, they got to break bread. You know, they have to also, there has to be a reparative strategy that those larger organizations should have as well in finding ways to re-grant, provide resources, support in some way to many of the communities that they have leveraged to raise money. And I think that a lot of times historically, and I think that's changing, but historically the frontline communities have not been positioned to be able to ask for those resources. But I think philanthropy is getting more and more diverse, and we're having leaders inside of these foundations that look like some of the leaders who represent these frontline organizations, and so these bigger questions are being asked now. But I also think that it's important for these organizations to be proactive and really begin to think about how can we lead by example and begin the process of investing some of our resources or technical assistance or capacity with and in the communities and with some of the organizations on the front lines that are doing this work. I just think that has to be a critical component of it as well.
It's necessary. I know we're at time. Do we have time for like 2 questions? 1 question? 1 question. And I do encourage you to come check everybody out on the break. So, yes. Or wherever.
Hi. Thank you. Karen Linnell from Alaska. I just want to say that one of the things that we're seeing with the Tribal Co-Stewardship Joint Secretarial Order is we've got more NGOs pursuing that funding on behalf of tribes, and again, not seeing that funding come to us. You mentioned money getting given to the states that cause the issues as well. We're seeing that with the Pittman-Roberts funding, which is a tax for every tent and every bit of camping gear that you have, plus the fishing poles and the guns and bullets, fishing hooks, all of that gets taxed and is supposed to go towards conservation. And it goes to the state. In Alaska, we have 56 tribes not able to fish on the Yukon River for the last 5 years. We've got 3 caribou herds crashing in the last 4 years, to the point where there's no hunting at all by anybody. And one of the things that we're looking at, it's been done with some of the funding through EPA for where tribes get treated as states, and they're able to access some of that funding to do conservation projects. We'd like to see that with the Pittman-Roberts, so any help that you can provide in that area, it goes more to direct conservation projects on the ground. And to the young man's point on health, connection to the land makes us whole. And it's not just tribal people, it's all of us. And so getting reconnected to the land and looking at that, and you know, I live out in the bush. My village is 80 people strong, and but when, you know, feeling the inequity across the country is something that we all face, and I appreciate it. Your conversation in your direction, you know, what we can do here in lifting each other up is so powerful, and I appreciate this space to be able to connect with you all and share your stories, but just in return to ask the same. Thank you.
Thank you so much. And there's a request there, so make sure we all do that connection. There was one question right here, Amanda. This will be definitely our last question.
Thank you. Yeah. All of you are so amazing. I'm so nervous, but I really admire all of you. My name's Marisol. I'm from Laredo, Texas, and I really want your expertise. Yeah, 956. I really want your expertise on, I spearheaded our first Urban Heat Island campaign in collaboration with NOAA, and we have a 20-degree difference in the concrete, and these are just our student athletes, FedEx workers, or an elderly person that took the wrong turn going home and just dies. We went from 2 deaths of excess heat and jumped to 15 in just 1 year. And my question to you is, we got the data, we collected the data. It was a beautiful community science event that we mobilized. My question to you is, your advice, we got the maps, it's all red, of course, and the concentration of heat. What's your advice? Because I need to present this to City Council and tell them here. I've talked to some of you yesterday, and my specialty is science communication, because as a scientist I can do all the research, but if I can't make it digestible and approachable and demystify it for the general public, it's useless. So I really want your advice. How can I talk to City Council and make them put their egos aside and just listen to me and tell them, I have the data, we need to act. Please help.
I feel inadequate in what I'm about to say, because it's 99% of my job is federal policy, and so in terms of federal policy, like, we've got to get FEMA to address extreme heat as the issue that it is. And exactly, you know, I'm so sorry that you're experiencing that in your community. That story is happening across America, and again, extreme heat kills more people than all of these other natural disasters combined. In fact, even in some of the recent hurricanes we've had, Hurricane Beryl in Houston, the leading cause of death was extreme heat exposure, because you have a hurricane followed by power outages, followed by a heat wave, and so people are dying in their homes because they don't have adequate insulation, they don't have adequate tree cover, and the power's out for 2 weeks. And we know which neighborhoods are getting their power back on first. And so we spend as a country about $20 to $70 billion a year in disaster relief and preparedness funding. And a fraction of that is going to what kills us the most. And so I would just implore you, that's a policy solution. And going to your city council, that may not be effective, but we have the tools, we have the money. It's a matter of how we're prioritizing where we're spending the money. And so we've got to get extreme heat treated, whether it's through legislation, amending the Stafford Act, or whether it's through FEMA, using their existing authority, which they can do, they use this money to fund COVID. There's nothing written in the Stafford Act about COVID, but they used that to come up with those dollars. And so we have the resources when people are literally dying. And so you would hope that would be enough. Unfortunately, it's not. But I just applaud you for your courage and continuing to tell that story and demanding that we treat this issue with the urgency that it demands.
I'm just going to quickly add to that what I would suggest in addition to that is, first of all, it shouldn't be the city council. It should be your city council. Somebody should be on it. Some people should be on it from the community. We never think about that. Public service commissions and all that. We should be holding those offices. At the same time, we demand opportunities to be heard, meaning people from the community come and tell their story. Talk about the person who made the wrong turn, the family member who died. Let people see that this is real. We're not here to take money from whatever it is y'all are coveting this money for. People are dying here, you know? And also, and this is crazy, but it's true, get it out as far and wide as you can, because it's hard to ignore once it's everywhere and everybody's talking about it, except because if you have to embarrass them, you do that. And if they're not doing what you need, then should they really be in office, right?
One of our things that we did for a CBPR project that I was PI on is we started inviting the SAFE city council and state representatives to our table. And whenever I say our table, the literally tables that we set up with researchers and community members around it, and we explained the data to them. And again, thinking about this work was done in an undocumented community, right? So we're not able to get people onto the city councils always. And so inviting people to the table, asking them to be there, putting it in their face, and really thinking about what are the other councils in your community that you should be presenting this work to. We did, rather than city council, we didn't have a friend on city council, but we had a friend on the city planning commission. And we went there. This project was specifically about lead, so really thinking about how lead is impacting the Latinx community in Norristown. So just really kind of thinking out of the box and inviting people to your table if you're systematically barred from being at their table.
Yes, amen. I'll be short. So there's a policy solution and then there's a power solution, right? And I think that it's going to be really important, and you've heard some of this. First, you've got to engage the young people in the community. Movements can't happen without young people leading the way. So what are you doing to ensure that young people understand the challenges that they're facing in that community and using their expertise in social media and other skills to really get it out to the broader community? It's amazing what young people can do with social media and TikTok and communicating the challenges. And you can even design some type of mini grant, you know, because you're at an academic institution, right? Right, so you can create some type of mini grant to provide to young people to actually help them to develop some type of communication strategy through social media about the heat challenges in the community. I would also, again, try my best to find other partners outside of the community that have similar challenges so you can expand your influence and power. People in power usually try to compartmentalize challenges in ways to justify why they're not listening or to marginalize your voice, right? So if you can connect to more communities that have that same issue, organizations like the Nursing Association and other groups that can also stand with you, it creates an ecosystem of influence that can go with you into that city council meeting. And I'm so glad you said that. Elected officials work for us, right? We don't work for them, and it's important for you to right-size that relationship and help them to understand that. And the last thing that I would really encourage you to do is to not just come with a problem, but also a solution, right? So power concedes nothing without a demand, right? Frederick Douglass said that. So if you're going to say we need to change this, then as a researcher, you need to be ready to provide recommendations for what you want on the policy side of things, but those should be informed by the community that you serve, right? Because we believe at PSC that the people that are closest to the problems are actually closest to the solution. So how are you co-creating the solutions in ways that can bring power to the community, as well as a point of reference that the city council cannot refute? So those are just some of the things that I would recommend. Yeah.
Thank you, thank you. A lot more to say here, but if you were listening, which I know you all were, there's a lot of takeaways from this discussion. There's a lot of things that we all can do. There's a lot of reflection that I hope you take advantage of this beautiful space to do. We're all here too, to help each other out. So I'll be talking to the sister over here. I've got some ideas. We didn't get to do our joy point, that's all right. Talk to everyone about what brings you joy. And just want to seriously thank you all for what you do, how you show up, coming here. Thank you for your attention. And now we're moving over to Jeremy. Thanks.
Hey, everyone. Wait, hold on. Huge thank you. That was a fantastic panel. So give it up to the panelists. That was fantastic.